So we're in Thailand with Brooke, physiotherapist from New Zealand, and studied with me 2012 with Dr. Narkish
Yes.
in group in Holiday Garden, and then come back 2013.
Yes.
So we done 2 weeks and 2 weeks, and then we done a bit of a gap. And then we saw you 2015 to do the extremity, but we studied, I think, modified osteopathy and chiropractic, didn't we?
Yes.
And now you're back in 2019, and we're studying APBC technique.
Yes.
So how you finding that? We've done like 4 and basically finished 5 days, haven't we?
Yes.
Completely on a one-to-one.
Yeah.
And we've had bodies coming in with, everybody's had problems, haven't they, pathologies.
Yes.
So what do you think about the specificity and the results of APBC technique compared to what we learned before in modified osteopathy and chiropractic?
I think the key thing is it seems a lot more specific and precise, and the biggest thing is you can't argue with the results. So I've seen a couple of patients with long-standing chronic pain, 10 years, 20 years, and one session with Robbie adjusting the different listings, soft tissue, and the symptoms are just gone. So I think for anyone who doesn't understand, or anyone not sure, you can't argue with that sort of result. It's almost like magic.
So it's like one lady come in with neck pain, with radicular pain, and tingling in her right foot,
Yes.
and then wakes her up in the night time, and doctors offering a surgery for the neck pain and radicular pains on kind of big bag of medicine, unbelievable amount of
Yeah.
medicine, from gabapentin to pregabalin and all these drugs. But on that, at the time, she was only on one. Gabapentin, wasn't she, at night time?
Yeah.
And then we applied APBC technique to her, and then I said I would expect a 50% reduction in pain, didn't I?
Yes.
Which you thought was a bit
She seemed like a very complex patient. I sort of thought we might get a little bit of improvement in the first session, and then come back and we do again, and we do it in stages, but one session and totally different.
so there was like 100% resolution in symptoms, wasn't there?
Yes.
There was no pain in the neck, no pain down the arm,
No.
no pain in the foot.
No.
And then she's come back today for a follow-up, and then she's 99% better. Just a little bit of pain in the arm, but 99% better, isn't she?
Yes.
She said.
Yeah.
So
And that
then-
was a lady who was, if she had not seen you, she was going to have surgery, possibly.
Yeah.
So it's a possible surgery case to 100% gone,
Yeah.
one session.
And on the MRI, it's nerve root impingement both sides, and with a bad big disc bulge, and technique was gentle.
Yeah, she tolerated everything really well because they're so gentle, the techniques. And the order, that's the other thing I really appreciate now that it's changed, is a slightly different order, but makes more sense from clinical reasoning point of view. And works, I mean, what I was doing before worked well. This is like times 10.
Yeah, because we worked on her laterality first, and then we got rid of the rotations with superior inferior where the disc bulges are made, and then we got rid of the anterolacesis, didn't we?
Yes.
After balancing the occiput and T1, the C2, C1 and the TMJ.
Yes.
And she was really happy, wasn't she?
Yeah.
Still happy.
Yep.
And then there was a man came in that had insomnia for how many years?
20 years.
20 years. 20 years of insomnia. And we did what was it? A cranial.
Yeah.
Occipital alignment, C1,
And the facial
C2.
cranial.
Yeah, facial and cranial.
So that was like a new technique that
Yes.
I've developed. It's like with a drop board that realigns facial bones. So it's like facial cranial APBC technique. And we did that. Plus we realigned his upper neck and entire neck. And then his neck pain is gone, which was waking him up at night, right?
Yes.
And then what else?
And then he sleep, very deep
Yeah.
sleep, good sleep, no problem.
20 years not sleeping, one
Yeah.
session sleeping.
Sleeping properly one night, sleeping properly last night
Yes, and don't wake up at night.
with pain.
Yeah.
So he's sleeping properly, and he's had 20 years of insomnia,
Yes.
and now he's had 2 good nights sleep. Is that what he told you in Thai language?
Yes, that's what they said. No wake up, just sleep all through the night.
So he must be very happy, you know.
So
He looks happy. When he came in, he looked so happy and relaxed.
So you think your journey of studying modified osteopathy and chiropractic and then developing it into APBC technique was worth it?
Absolutely. Like for me, I needed to take it step by step. So my journey was right for me. I needed to learn this and do it in layers. But having seen what you've shown me in the last 5 days, this is the top layer, the best layer. So now I'm going to go back to New Zealand and treat all my patients with the new system.
Good. And how has it been working in New Zealand using modified osteopathy and chiropractic?
Very good.
And the way that I taught you that in 2012, 13 and 15.
Yeah, it works very well. I see probably 50% of my patients are people that have already seen other chiro, osteo, physio, or they've had pain a long time, and so they don't even think it can be fixed. And those are the people I do the best with, because there's old misalignments that have not been addressed. So just because it's been there a long time doesn't mean it takes a long time to fix. It's just people are not seeing the things and not treating the right way.
Good. Well, it's been great to see you over the years. I've seen you develop into, and when you first came here, you was working for someone,
Yes.
and you was just an assistant to a chiropractor.
Yeah.
And you was basically doing their electrotherapy and soft tissue and rehab, weren't you?
Yeah.
And then you said in 2012 you was thinking about opening a clinic. 2013 you said you was thinking about it even more. Then I think back into 2013 you went for it.
Yes, I did.
And you opened your own clinic. And then 14, 15, 16, 17, 18, 5, 6 years later, here you are, and you've got one of the biggest practices in Auckland, and you're doing really well.
Yes.
So you think it's worth learning manual therapy with our school?
Absolutely. I've trained with different people, looked at different techniques. This is by far the best, not even close.
That's really nice of you to say, Brooke, and I'm glad it's come to a conclusion today. And we've got a couple of more patients to treat in there, haven't we?
Yes.
They're waiting
Queue
for
up.
us.
Yeah.
Waiting for us. We've got a queue now.
Whole day
So,
to queue up.
but our training's finished. So thanks for coming and thanks for studying with us.
Thank you very much.
Cheers.